live in Washington, D.C., right here. You might know us because we are known for our beltways and our old ways and the politics of today. I work in healthcare. You will know healthcare because of our modern communication, our cutting-edge technology, and our award-winning patient experiences. And if you're putting two and two together, you're probably thinking DC, healthcare. These are two pretty exclusionary things. But that's not how I see the world. This is my friend, Matt. And Matt does this incredible thing. Whenever he sees somebody lost or looking like they don't know where they are in Washington, D.C., he walks up and he says, "Can I help? Are you lost?" And that's because this is our D.C. This is a city where everyone is included. It's a city that reflects our entire country. It's a city where all of the monuments in every part of the city belong to all of us and reflect all of us. It's a place where you can show up and build a snowman on the front lawn. And these are the healthcare experts I know. They believe in inviting everyone to the table and valuing everyone's opinions, and where the only ticket to the hip crowd is the willingness to ask, how might we? So when President Obama announced the Precision Medicine Initiative and said healthcare research should be open and accessible to everyone, we at MedX and the folks at the Office of Science and Technology Promotion thought, this feels like our kind of combination. So we set out to host the most Medicine X DC kind of meeting we could. One that was inherently for and about and including everyone. And you're probably asking yourselves what that looks like, and so I'm going to show you. This is the entrance that the vice president uses to arrive to work, and where patients from this room, from around the country and around the world, showed up with healthcare professionals, policymakers, lead researchers, all entered the building to do this incredible work together. It's pretty dramatic, right? So you're probably wondering what a room full of that kind of experts looks like. Let me show you. The kinds of meetings you hear about behind closed doors, this is one that's all about open doors. Can you see in the room that there are patients with type 1 diabetes and Parkinson's and rare genetic conditions? Do you see the researchers and the experts? Do you see the physicians and the policymakers and the designers? It's pretty easy to tell who's who, right? Let me make it a little easier. I'll show you the credentials. You see all the letters after the names? This is our version of everyone included, where the doors are open and where the credentials don't matter. But like we heard Dr. Chu say this morning, it's about the ideas. It's about solving for the bugs, thinking about the things that are working, and the big ideas that we really need to expand on. It's about what's said in the room. It's about what's not said. And it's about the ripple effects that come out of this work. And we heard some of those were about people whose work in their home fronts were influenced. You're going to hear some of those stories. People who came to understand some different needs in the room that day and continued that work, and you're going to hear some of those stories today. And just the amazing proliferation of the ideas that happen when you have this broadening of perspective that we're experiencing here in Medicine X this weekend. You're going to hear about it really soon, by the way. But I also want to take this moment to ask all of us a question. I want to ask a challenge for our country that I think this group is uniquely qualified to answer. It's a question of how are we going to continue this idea of everyone included in our national healthcare policy. It's a time when we really have to ask the question, how might we keep everyone included in a dialogue around the policies to improve healthcare? In a minute, you're going to hear from lots of experts, and we're going to invite you to join us over the weekend for the continuation of this. I want to share one of the quick ripple effects that this experience had on me. This is the team I get to work with in my day job. These are also engineers and nurses and administrators. And we pride ourselves on being an everyone-included design team. And you'll notice there's somebody missing in this picture. When we left that experience at the White House, we were inspired to really, truly think about what it means to be everyone included. And some of you know that this year we lost, among many of our other incredible e-patient advocates who've passed, a dear friend and colleague, Jess Jacobs. And Jeff's left behind a legacy of optimism and a compendium of examples on how we can continue to build a better healthcare system. And many of us at DC knew Jess very well. And so coming soon, and very much inspired by this work and the examples you're going to hear about today, we decided that it was very important to launch a scholarship in her name, a paid opportunity to come join a hospital-based design team and have the same access to the same resources, for your time to be valued in the same way that people who chose that as a vocation, not because of the result of a diagnosis or a condition, we have access to those same things and resources. And that felt very inspired by this meeting that you're about to hear about. So that was a ripple effect on our team, and now I'm excited to tell you, to turn this over to some other folks to hear about their work. Leonard?
Nick, can I say just a word? So the things you're going to hear about are projects that were born out of this day, where teams came together in the moment and have been continuing their work since then. So you'll be hearing about them here on stage. These are just 4 of the projects that we came up with. And then I'll talk a little bit about how you can join in the fun.